Hi, my name is Laurel Santiago. I'm a nutritionist and a pharmacist from the Integrative Center for Nutrition. Today we'll be talking about how to resolve health with nutrition using organic acid tests, amino acid tests, and the fatty acid tests. The patient provided her results for educational purposes. She's a 47-year-old obese woman. She has symptoms of hypothyroidism, although her lab values came back all within the normal limits. So she wants to know why she's feeling so fatigued all the time, why her skin is so dry, why her cholesterol and triglyceride levels are up, and what can she do about it. Let's take a look at these tests and figure out why she's feeling the way she is. The first page is the essential amino acids. We can see here that they're generally low. We want to ask ourselves, why are they low? What could the reasons be? It could be that her diet is poor. It could also be that her diet is good, but the nutrients aren't getting absorbed. They might not be getting absorbed from low stomach acid or from dysbiosis, or maybe they're not getting absorbed because there's not enough pancreatic enzymes. We'll find out. First, we're going to take a look at her vitamin B6 status markers. Here we see that the markers are very low, so she's deficient in vitamin B6. We're getting a picture of why she's not feeling well. The other things that we want to look at, because these markers are all low, is how is it affecting her brain and her energy level. So here we see her neurotransmitters and precursors in her brain, and these are also generally very low. The phenylalanine and the tyrosine being on the lower side like this show that these elements are being depleted. Maybe they're being pulled in for other resources. But the phenylalanine and tyrosine are the building blocks for thyroid hormone synthesis. So these values being low would certainly explain why she's having symptoms of hypothyroidism. The taurine also being low would also indicate to me that there's a problem with absorption, maybe due to lack of stomach acid. Here we see our sulfur amino acids and her glutathione production. And these values also being low would explain exactly why she's feeling so fatigued all the time. She's unable to make glutathione, which is what we need for energy. And I believe that the essential amino acids are being pulled to try and being used in the cycle to produce the glutathione, and that also explains why her essential amino acids are low. In her urea cycle here we see that the citrulline is low. This tells me that her condition is worsening, and left untreated or unaddressed will cause a buildup of ammonia and toxicity. Here we have the elevated homocysteine. It could be from the deficiency of vitamin B6, but it could also be from other things. So we don't have all the pieces yet to put together. We'll be looking at the other markers to determine if that is the only cause or the real cause, or if there's another cause. Here we also have low magnesium and a high copper. We want to look with our zinc and copper and selenium, and also take a look at our toxic element profile. While there's nothing indicated in the red zone indicating that it's high, we do see that there's especially some exposure to aluminum, arsenic, and mercury. That's something we want to keep in mind as we take a look at the rest of the functions and how the liver's performing. Here we see that the patient is deficient in beta-carotene and a little on the low side with vitamin D. Here we have the fatty acids in the plasma, and we can see that the saturated fats have a particular pattern. They're high. For this patient, with everything else we've mentioned, I would interpret this as having metabolic syndrome. So the patient would be eating processed fatty fried foods and high refined carbohydrates to get this kind of pattern with the elements that she's had from the previous slides that we've seen. I would then also expect that her omega-6s and omega-3s will be off. Probably too many omega-6s and not enough omega-3s. Let's check. Here we have the polyunsaturated omega-3s and the polyunsaturated omega-6s. And we could see that the omega-3s are low and the omega-6s are they're mixed, but they're also high. So this confirms my thoughts. In the urine, we also take a look at the markers to have more information and confirm or provide deeper information on the blood values. The lactate that's high in the urine confirms to me that there's a yeast overgrowth that would need to be addressed. Here we can also see with our citric acid cycle that the elements are high. Initially, it might sound good that they're high, but what that means is that they're accumulating because they can't revolve around the citric acid cycle to produce energy. So either there's a deficiency in the enzymes or there's a deficiency in the cofactors. We can also see from this that it's vitamin B12 that's causing the elevated homocysteine and not the vitamin B6 as we initially thought. Last but not least, we take a look at bacterial and yeast overgrowth or signs of overgrowth. But first we take a look at the benzoate. The benzoate tells us how the liver's doing with first pass, and because it's high, I would suspect that the heavy metal exposure is interfering with the liver. In this particular patient, she's struggling, so we want to address that. We also see here with the D-lactate and the D-arabinitol that these elevated levels confirm again yeast overgrowth. So our nutrition prescription is to treat that yeast overgrowth first, to also supply free-form amino acids which will help give the building blocks and normalize the body functions. Arginine, glycine, lipoic acid all help with CoQ10. The vitamin B complex will help with the vitamin B deficiencies and help the methylation process and have the homocysteine return to normal levels. Folic acid, magnesium, calcium, and beta-carotene supplementation because those values were low, and vitamin D3, zinc, and selenium, and that will help with the liver detox. Also, the patient will be instructed to eat a nutrient-dense whole food diet to avoid any refined carbohydrates, processed foods, fatty, fried foods. Eating fish a few times a week is a good idea, especially if it's wild-caught salmon, mackerel, or sardines, fish that aren't known to be high in their toxicants. On follow-up, the patient returned 58 pounds lighter. She lost the 58 pounds. She also decreased her thyroid antibodies. She decreased her triglycerides and her cholesterol, and they returned to normal levels. She's no longer in pain, and she's even running 12K races. She's looking and feeling great. If you'd like more information, come visit me at icnutrition.com. Thanks for watching my video.